And service will come to order. Good afternoon again. I didn't have my mic on. Welcome, and Madam Clerk, we will get started.
Commissioner Baker McCormick, Commissioner Marecki, Commissioner Anderson,
Here.
Commissioner Colleen, Chair Scott,
Present.
you have a quorum present.
Thank you. Next item.
B, Chairwoman's remarks.
I don't believe I have any at this time. Thank you. Next item.
C, approval of the May 12th, 2026 meeting minutes.
Moved by Commissioner Colleen, supported by Commissioner Marecki. All in favor? Say aye.
Please vote using your tablets.
Oh, yes. Thank you.
Motion carried.
Thank you. Next item.
D, unfinished business. There is none listed.
Next item.
Moving to item 1 under new business, requesting commission approval of a retroactive no money memorandum of agreement with Henry Ford Hospital, formalizing the hospital's role in providing outpatient drugs to indigent and low-income Wayne County citizens under the United States Department of Health and Human Services Office of Pharmacy Affairs 340B program.
All right. Thank you. All right. Thank you.
Good afternoon, Dr. Sheth, Chief Medical Officer for Health, Human, and Veteran Services. This is an agreement that we've had, no money MOU, memorandum of agreement that we've had in place with Henry Ford for quite some time. And it supports their ability to be a 340B program provider. And so the 340B is a federal program that allows for competitive drug pricing and healthcare systems who serve particularly low-income indigent populations to really purchase drugs at a very low cost to offset some of the costs they have when they see individuals who are uninsured or uninsured. And so we've had this, it's a requirement for Henry Ford to provide some sort of support or agreement by local county government. They, as you all well know, are a premier health institution in our Wayne County region and do serve individuals regardless of ability to pay. And so we thought it would be important to continue this agreement so they can continue to be a 340B program.
All right. Thank you. Are there any? Commissioner Peterson?
Thank you, Madam Chair. I did have one question. I know this is Henry Ford, but is there a reason why other like DMC is not included? Because as they too are a 340B program.
Yeah, so I'm not sure, but DMC may get their agreement through Detroit, perhaps. So Henry Ford is the only our local health system in Wayne County that has reached out to us for this type of agreement for 340B. So I'm not quite sure what DMC's program is under.
Okay.
Okay. Commissioner Marecki?
Thank you. So we really have nothing to do with this except be their government entity supporting it.
Exactly.
Okay.
Yeah.
All right.
Thank you.
And Madam Chair, Commissioner McCormick has entered.
Duly noted.
The chair then. Okay. Commissioner, no. Okay.
I'm moving to approve, Madam Chair.
All right. Is there support? It's been supported by Marecki. All in favor? Motion carried. All right. Thank you. Next item.
Item 2, requesting commission approval of a retroactive comparable source professional services contract with a 5-year option to renew with Oakwood Healthcare, Inc., DBA Coral Health, for outpatient tuberculosis clinical services to residents of Wayne County.
All right.
Thank you.
wanna speak on this?
Sure.
Yeah.
Dr. Sheth, Chief Medical Officer, Wayne County HHVS. This is an agreement that we've had with Corewell for quite some time to continue providing outpatient clinical TB services for out Wayne County individuals. Tuberculosis is a mandated required service that we have to provide as a local county health department. They are our clinical provider for quite some time. We are grateful that we have this partnership. They happen to be an expert for TB care in Michigan and quite frankly, our region. And so it's nice that they're just down the street from us and we get to continue this partnership. We have a good partnership where we are doing kind of the public health aspects of the tuberculosis cases and exposure. So we do the contact investigation and monitoring and a referral for treatment. And then we lean on them for their expertise as a clinical provider and for their specialists to provide the clinical medical treatment for individuals diagnosed with TB or have to be evaluated for tuberculosis for out Wayne County. And so this agreement allows that to continue. It's a 5-year agreement. And so we look forward to continuing this partnership.
Okay. Do we have many cases?
So thankfully, we've been relatively stable in terms of TB cases year to year. There was a slight uptick during the COVID pandemic that we believe is due to people delaying, care and treatment. We've kind of since had a steady rate of cases. There's 2 types of tuberculosis. There's active tuberculosis and what we call inactive or latent tuberculosis, which is basically you've been exposed to TB. It's in your body, but it's sleeping, not causing any symptoms. And so every year we do see significant cases of this kind of sleeping tuberculosis and really encouraging those folks to seek treatment as well through our Corewell provider.
All right, thank you.
Mhm.
Commissioner Marecki.
Thank you, Madam Chair. So the Grosse Points, Harbor Woods, Highland Park, and Hamtramck in the city of Detroit are not covered under this. So are the rest of those cities covered under Detroit?
Yes, that's
Okay.
correct.
Okay.
And they have a partnership with DMC Wayne Health to provide their TB
Okay.
care. Mhm.
Thank you.
Thank you. Is anyone else?
I'll move approval, Madam Chair.
All right.
Since
Been moved
Commissioner
and
Marecki
supported.
my Question.
Oh.
Good job. No, it's all right. We're countywide, baby.
All right. Okay.
Please vote using your tablets. Commissioner Anderson,
Oh, okay. Yeah, I see. All right,
motion carried.
thank you. Next item.
Item 3, requesting commission approval of Amendment 4 to a 4-year memorandum of understanding with the Wayne County Prosecutor's Office to continue the Right Track Diversion Program at the 3rd Judicial Circuit of Michigan Juvenile Division for fiscal year 2027.
Good afternoon,
Good
Rachel
afternoon.
Davis, Department Director of Juvenile Youth Services.
Thank you, Ms. Davis.
Good afternoon, Portia Carlisle, Manager over Contract Programming.
Thank you, Ms. Carlisle.
So we're here today to look at a 4th amendment for the MOU contract between Wayne County and the Prosecutor's Office, not to exceed $475,236 and extending the term into fiscal year 2027.
Any questions? Commissioner Peterson.
Thank you, Madam Chair. Director, so I guess I have 2 questions. 1, why the increase in dollars? And then 2, is there any data on the success and the impact of the program? I didn't see that, but maybe I overlooked it, or if you've already discussed that previously.
I believe there were some commission questions related to the Right Track key outcomes. So a few things I have listed here are there have been 4,102 youth served since inception.
Okay.
3,702 youth have avoided recidivism and 240 additional youth are expected under this amendment, which is the reason for the additional monies added to the contract.
Thank you.
Thank you.
All right.
If I can just add that, no, that's for a different portion. But yes, that's all I have for Right Track.
Anyone else? Commissioner McCormick? No. Oh. All right. So. get a
I'll move
motion.
approval, Madam Chair.
Thank you. Moved by Commissioner.
We already have a motion by Commissioner. Thank you.
Marecki and supported by Commissioner Killeen.
Thank
All
you.
in favor?
Please vote using your tablets.
Thank you. Motion carried. Next item.
Item 4, requesting commission approval of Amendment 2 to a 3-year grant agreement with up to 1 2-year option to renew with the City of Wayne to amend the scope to reflect the state of Michigan's change in eligibility for child care fund services and continue to provide prevention services for at-risk youth through the First Contact Program.
Yes, so for this contract, it is the amendment number 2. We are seeking to renew this to maintain operational and fiscal flexibility. There have been some changes to the child care rules as far as the ages of youth that we are eligible to serve. And that changed from 10 through 18 to 10 through 17. So we are going to amend that process in this amendment structure and also adding money to the contract.
Okay. Commissioner McCormick, I think I saw hers first.
Yeah, that's fine.
Thank you, Madam Chair. With, because we made some changes, from, the age range to 17, where are they housed in comparison to, the younger kids
So
in JVS?
So these youth are in the community. They are not within the institution.
Okay, but for those that are, it's still under the age of 17 that we have in Wayne County, right?
Yes,
Is that
Commissioner.
correct? Okay.
Yes.
So as far as housing in the JVS, how do we separate them? That's the question.
So in the juvenile detention facility,
Mhm.
we house up to 18. Once they turn 18, we typically have to transfer them to another facility.
Okay.
But in the
And before you go on, where are they transferred?
sometimes they are transferred to the community on tether. Sometimes they are transferred to the adult detention facility because we're licensed to house up to 18.
Okay. And then how are they separated currently?
Currently, they're separated, so they are classified. We are sure to keep them separate from either their co-defendants, from any enemies or known gang members that that they may have issue with. We also separate based on age and types of offenses.
Okay. So I know they're housed in pods, and so is one pod just for youth that are from 15 to 17, or how are they, not just by offenses but by age range? That's what I'm asking. Are they housed differently?
We do,
Okay.
both gender and by age range.
Okay. So what does that look like? That's what I'm asking.
So there is movement within the facility. Again, this amendment has nothing to do with
I know.
okay.
Yeah, I just was curious as we talk about, service of youth. I was wondering because that came up in another meeting I was in. So I just wanted to clarify that.
Okay.
Yeah.
So yes, we typically try to keep them, housed with similar age ranges. So for instance, if we have the opportunity to house a 13-year-old, we would ensure that we didn't house them with an 18-year-old unless there was like no other possibility for housing, because sometimes you do have incidents from housing unit to housing unit, which forces us to move them and keep them separate. But the ideal and the goal is to separate them based on, age groups.
So what age groups?
So from the youngest the
Mhm.
youngest age group. So let's just say you could have 13 through 15, you could have 16, 17, 18-year-olds. It all depends on what the ability for us to house within the facility at the time. But the desire and the ideal outcome is that they're in appropriate age groups as opposed to having maybe the youngest 13, housed with someone who's 17.
Okay. And from what you just said, there are instances where the younger age groups may be with the older
It is
kids. Okay.
within the realm of possibility, but that's not the typical situation that you might find. Again, we have had youth who were housed on 3 or 4 different housing units because of incidents or altercations that they've had. So, in the sense of let me do what's most safe for this youth, which in that scenario will be to keep them away from known enemies, known people who they may have physical altercations with, they could land on another unit with potentially younger or older other residents.
Okay. Thank you.
Okay.
Mm. All right, thank you. I guess I'm kind of concerned. Has it happened before though, that the 18-year-old and the 13-year-old?
Well, typically, once they turn 18, we're able to transfer them outside of the. I can't say for sure. I can't say for sure.
Sorry, I apologize. We are in litigation. So I don't know the details of that litigation, and I was trying to pause as we kept having questions, but
Okay,
I don't want to go too far because I don't know the details, and I was just making sure that she understood that.
okay,
Have that, she should be mindful of her response.
very good. All right, thank you. I'll leave it alone.
Thank you.
Commissioner Marecki.
Thank you. So I thought all these childcare fund programs that we had, that it was kids under 18.
These are
But what's the change of the 7 years to under 18? What is that?
because formerly it was 10 to 18 and they've reduced it to
From
17.
7 to 7, from 7 to 17 or 10 to 17?
Now it's 10 to 17.
What's the 7 years to under 18 years?
Well, yes, so 7 to under 17. So they changed the age range in which we could service.
Okay, so before it used to be,
7?
So previously it was 7 to 17.
okay,
However, there's an MCL code that the child care fund is following that says that a child cannot be in services until they're 10 years old. Anything under that, then they're no longer eligible for services under 10. So it was
Okay.
previously 7 to 17, and now it's 10 to 17.
okay, all right. So, okay, that makes sense. Thank you.
No problem.
Okay. All right. Commissioner Peterson? No.
Madam Chair, I was just wondering how that age group now is getting served. You would hope that they are very young and they would not need the services, but reality is that 7 to 9, I'll just say 7 to 9, there are services needed as well. So who absorbs that?
The way that it was explained to us by the state, which made the change, was that youth that were 7 to 9 couldn't be within the juvenile justice system. And that's why they eliminated that age group from being able to be serviced. So any services that they would need would come from basically another category and not falling under juvenile justice or child care funding.
Okay, but they will get services based on
Yes.
any infractions on behavior.
Correct. And the providers do a really good job of supporting each other
Yeah.
by having collaboration on different programs that are available. So that way they can still be serviced, but
Yes.
maybe not through their program.
Okay, yeah, I don't want anyone to go unserviced,
Correct.
no matter the age. Thank you, Madam Chair.
All right, thank you. All right. Get a motion? It's. Oh, yeah, it's here. It's
Really blunt.
It's moved by Commissioner Kleen, second by Anderson. All in favor? It's vote. All right,
Motion carried.
thank you. Next item, please. Next item.
Item 5, requesting commission approval of Amendment 2 to a 3-year grant agreement with up to 1 2-year option to renew with the City of Garden City to amend the scope to reflect the state of Michigan's change in eligibility for child care fund services and continue to provide prevention services for at-risk youth through the First Contact Program.
All right.
And this is very similar to the last agreement, just with Garden City instead.
Is that the only city?
Yes, this is the only city.
All right. Commissioner Colleen?
Thank you, Madam Chair. Are we going to see new contracts from all of the YAP programs then to reflect this change in eligibility of age?
Correct. That is the goal, to amend all of them to be reflective of the age.
So we're going to see them coming through.
Yes.
Okay, thank you. Thank you, Madam Chair.
All right, thank you. Anyone else? Commissioner, moved by Commissioner McCormick and supported by Commissioner Colleen. Let's vote. All right,
Motion carried.
carried. Thank you. Next item, please.
Thank you.
Item 6, discussion with Diversified Community Services.
Good afternoon.
Good afternoon.
My name is Marcine Carmo. I'm the Executive Director for Diversified Community Services. Our organization was founded in 2013, and since then we've been providing prevention and diversion programs for at-risk youth, basically mostly in the city of Wayne County. We have also been a United Way sub-provider for First Contact since 2019. And this year was our first year that we became a YAP provider with Wayne County. Since our inception in 2013, we've provided programming for at least about 150 to 200 youth every year. And that's in the schools and community centers, individual families, and all types of, all types of services that we can provide. We are also a licensed substance abuse and mental health provider through the state of Michigan as well. So we do some individual and group counseling with them. Most of our services are after school and summer programs. So we provide STEM programming, STEM and drone. We provide a literacy program, all types of career development, workforce development programming for them. Individual, group counseling, life skills, social skills. So we go around we have different areas in the community. We service Highland Park, most parts of Detroit. We're in some after school programmings in the schools. So that is where we do some family engagement therapy resources. We do turkey drives, Christmas parties, and, summer kickoff programs and things like that to kind of get the families engaged as well. So we're excited to be a YAP provider now. We just started this year. So currently we have about 40 youth that are signed up, and we're looking to do about 200 this year for the summer, throughout the summer.
Thank you. Yes, thank you for being here. Any questions? Commissioner Marecki?
Thank you. I'm interested in your literacy program. Now, how does that work? Do you target kids that are in your group, or?
We really do it for all of the ages. The biggest age is like from up until 4th grade. That's the biggest issue. But what we found was after 4th grade, where do they go from there? There's nobody teaching them. So now we've upped our program. So we still do literacy. We've got a new program coming up that's like 5th grade through 8th grade, because we know that literacy reading levels are low. So we're going after those 5th, 6th, 7th graders too, to make sure that their reading levels are getting to where they need to be, because most of the 8th graders are reading at like a 4th grade level. So
like historically, the programs I've known about have been quite expensive. Do you keep any stats on where they enter and where they
Yes.
leave and.
Yeah.
Okay,
So we do, so, within the last 4 years, we've had, 70% of our tutors have reported a student's increase in their writing skills.
Mhm.
We also have, 78% increase their grade point average through reading. So these were over the last, I think, 4-year span that we've been keeping stats. So we do have a good retention rate with the literacy program that we have.
so if the kids enter like in fourth grade, now they have the ability to keep going until they're at their grade level.
Correct. Yes.
Okay.
Yeah.
That's great, because those programs sometimes are quite
Yeah.
expensive.
Yes,
So-
no, we have a really good, we subcontract with the organization called Irby Education. And so they go through our schools. They're in some of our schools and they do the literacy programs there.
Okay,
Yes.
all right, thank you.
Thank you. Commissioner McCormick?
Thank you, Madam Chair. You service Highland Park
Correct.
and any other, I see you're in Garden City, so I assume
We're not in, no, that's not,
this,
no.
oh, I'm sorry.
No.
No, I'm looking
Yeah.
above that. But where are you located? That's
Highland
what-
Park, Hamtramck.
Where are you located?
Oh,
first?
our office is
Mhm.
located in Detroit.
Okay.
Yes.
And what zip code is that?
We're in 48221.
Okay. But you service not just 221, you're wherever the need is.
Correct. So currently, we're in Highland Park, we're in Hamtramck. We're in the 206 district. We're in the 219 district as well. It's, we're in different districts that need our services.
Okay, and I think that was it. Yep. Okay,
All
thank
right.
you. Wanted to clarify that. Yep. Thank you.
I'm sorry, Commissioner Peterson.
Thank you, Madam Chair. If I could get a list of the Detroit schools, that would be helpful for me. I know you said you were doing programs in the Detroit schools, so that would be great.
Yes.
And then also for the workforce development programs, is skilled trades baked into that, or what type of workforce development are we doing and at what ages?
So right now, our biggest workforce development program is the drone program.
Mhm.
We're in various schools throughout Detroit, and I'll give you the list that we teach them how to do blueprinting, how to do coding. So the skills that drones use, construction, videography, all types of things like that they'll be able to have that trade. We recently just started a nursing program that we're going to start this summer for the girls or boys that want to be in nursing. And we also have a construction program that's also starting this summer. Drone was our biggest one that we have been incorporating through everything, but our other workforce developments are starting with this summer.
Okay, and you have partnerships as it relates to these
Correct,
programs?
yeah.
Okay.
Yeah, and so the schools that we're in with the drone right now, we're in Durfee, Schultz, Wise Academy in Dearborn Heights, or Dearborn. We're in Western High School and East English Village we're in as well. And Detroit Service Learning Academy is one of the schools, a charter school as well. And I know there's a couple, not Mackenzie, I'm sorry, McDowell. And I know there's one more. Oh, Roberto Clemente.
So I think 4 of those are in my district. So good. That's good to know. Thank you. I appreciate that. And then, to my colleague's point about the reading and writing and literacy, so it'd also be great to see if students were able to move grade levels. I don't want us to give up on those once they get past 3rd grade. I know that's the area, but even teaching phonics, if we can start much sooner, then it eliminates the ability for them to need the services going forward. So that's something I think we should look at when we think about literacy.
Okay,
Thank you.
thank you very much.
Yes, you're welcome.
Yeah, that'll be great to get back to phonics. Okay. Commissioner Khalil?
Thank you, Madam Chair. Didn't hear you say Harper Woods.
We have been requested by Harper Woods, but I'll be honest with you, they never really returned our calls to get back with us. So
Say you requested, what does that mean?
Harper Woods Middle School, I believe, had contacted us to actually be a part of their program. But I don't know if it was something, I'm not really sure because I wasn't part of that as the executive director, but we have been in conversations with Harper Woods. But we just haven't really made contact with them.
Yeah, let's call it ongoing conversation. What, for a school or a district to come in on this, what are the requirements from them? What are you asking for?
We really don't ask for much. I mean, obviously, we need the applications for the youth assistance or first contact. We need those applications to get them approved through the court. And we don't ask very much for them. This is all a free program to them. We don't ask them for any money. We don't ask them for anything like that.
So they provide some space and
We just need the space. We need the times. We bring in the, the workers, the staff. And I know with some of especially like with Durfee and some of the other schools, they want to do tutoring. So we basically let their teachers do the tutoring and then we come in with the enrichment classes after that.
the literacy
Yes.
portion. And this has been stubborn for decades, that kids entering Detroit public high schools, on average, read at the 5th grade level.
Mhm.
And that's been true for decades.
Yes.
Do you get any state support for literacy programs?
No.
Because I'm looking for, I want to say 5-6 years ago, there was a court ruling in Michigan that Michigan students had a right to literacy. And I saw that court ruling. I was like, well, now you got to follow that up with money.
Yeah.
It just can't sit there. Nothing changes if you just go, oh, yeah, we have so the state is not providing any kind of support for
Not for
programs.
No, not for literacy specifically. We have the out of school time money that is for after school programming that we provide our own literacy through that funding, but not specifically for literacy.
So the court's ruled and the state hasn't provided
Correct.
anything to back that up.
Well, not to private organizations. I don't know if that's within the state, public school district that they do it.
Yeah, I'm not sure either, but the fact that we need outside organizations coming in. Well, thank you for being here today. It's great to hear all these different programs all over the county. Not enough money to get to enough people on this, but that we're kind of hacking away at the issues that are facing our kids.
Yes.
So thanks for being here today.
Thank you very much.
Thank you, Madam Chair.
Thank you.
Thank you. Commissioner McCormick and then Commissioner Peterson.
Thank you, Madam Chair. The time of the programs, are they during school, after school?
After school.
Okay.
Yes.
And so for a school to be a part of the program, they would just simply reach out to you and
Yeah.
voila. Okay.
Yeah, that's what the principals have reached out to us, or the deans have reached out to us and said, we would like to talk to you about your program and, bring you in. So yes.
Okay, great. I'm gonna make sure, because I didn't really hear any schools in my district, but you service from what grades? From
It's basically
K-12?
Well, we do K through 12, but for this, obviously for YAP, it has to be 10 to 17. But yeah, we do service K through 12.
Okay, all right. And summer program?
Summer programming, right now we're in Highland Park at the community center. Hamtramck has reached out to us for their summer enrichment, and we're in Durfee for their summer program. So that's an all day. That's, from 9 to 4.
Okay, that's what I was gonna ask next, 9 to 4. Okay, so great. Thank you.
Thank you.
In Highland Park, do you have all ages?
Yes, K through 12. Yeah, we're at the Highland Park Recreation Center, and we service, in the summertime, we service almost 100 youth.
Okay. Thank you. What about Hamtramck?
Hamtramck, they just responded to us. They want us to do 5 classes over there for their summer enrichment, just specifically for STEM and drone. they have reached out to us for, yes. So they have 7 schools in their district, but they haven't told us which schools that they want us in yet for the summer.
Thank you. Commissioner Peterson.
Thank you. Just from our colleague, $94 million in 2023. That's what was rewarded. That was awarded to DPSCD. That was a literacy lawsuit. So $94 million had to be spent by school year 27-28. So there were, yes. So a variety of programs and positions and all those things. Yep. And then also just to, so what's your bandwidth? Because I know oftentimes people want a lot of work, but they don't have the resources to deliver with excellence when they start spreading too thin. So have you reached that peak, or how do you expand? Are you just hiring more people? Because we've seen programs that they work really well with like 7 schools, but when they go to 17 schools, then everybody doesn't get the same level of excellence provided.
Right. The good thing about our organization is we subcontract out to other providers. It's not just staff within our organization. So like our literacy program, our STEM and drone program are subcontractors with us. So they have a bigger staff resources for us. So we don't have to go find all the staff that are teachers or literacy or, STEM, so we do have a fair amount of people. We haven't exceeded our bandwidth yet. We can take on a few more because, like I said, with First Contact and YAP, since we have both of them now, we can provide more services to schools and to students.
And they will have a mid-year with all the YAPs. I think we've asked for like mid-year data to see how the YAP programs are performing. Okay.
Right.
Thank you, Madam Chair. Thank you.
Thank you very much.
Thank you. Commissioner Anderson.
Yes, thank you for being here. And I'm interested to see if you have any type of information online that we could look
We
at.
do have some
Brochures.
brochures.
Very good. All right.
And our website is on there as well.
Thank you. Thank you. That's all.
Thank you. Commissioner Elaine.
Thank you.
Thank you, Madam Chair. For letting me back in. I forgot one thing that was on my mind. After school programming. We get into November, December, 5 o'clock, it's pitch black. I know this has been a problem for a lot of public schools, and I'm speaking from my Detroit experience. The parents just don't want their kids coming home in the dark. Do you experience a similar kind of thing about getting kids? I mean, right now, no big deal. It's light till 9 o'clock. But do you see with after school programming, when you have those early sunsets, does that cut into the number of kids that will participate?
It doesn't, well, yes, in the wintertime, it has cut into the number of kids. Our biggest challenge is, and what we want to do is we're trying to provide our own transportation. We want to get some buses and things like that because especially in some of our schools and stuff, the kids walk home and it's dark. So, we want them to be safe. So that's one of our biggest challenges. Another big challenge is just family engagement, parent engagement, getting them to come and pick up. So we try whatever we can to really make sure those kids are safe and get home. And, so that's what our biggest goal right now is, to really find get shuttles, buy buses or something, funding for some transportation so we can provide that. We do have a contract with Uber that if the kids are too far away from their school, we get them Ubers. So Uber will take some of our youth home that we know and that they're going to be safe.
Yeah, I think that's for a ton of nonprofits all over the place. The transportation issue is huge. So we have with the bus system now that there's free rides for kids going to school. What's the parameters on that? Can they use that service at 5 o'clock in the evening, or?
I believe they can. Yes, they can. Yeah. All day. I believe it is. Yes. Yeah.
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 But that also means there has to be bus lines fairly near where the school is.
Correct.
So they have to walk 9 blocks to. Okay.
Yeah.
All right. Thank you. Thank you, Madam Chair.
Yeah.
Great. How long are they in after school?
So we can, as far as hours or,
Yes.
there, some students arrive at around 3:30. It depends on where we're having our program, but it's usually until 6 o'clock.
Okay,
So they're there for at least 2.5 or 3 hours.
thank you.
And we do provide them with food. We provide them with meals and with snacks
Oh,
as
okay,
well. Yes.
very good.
Yeah.
Thank you so much.
Thank you.
Yes. Yes. We appreciate this.
Thank
All
you.
right. Well, great discussion. Thank you.
Thank you.
Mhm.
Thank you.
Uh, Next item.
F, such other matters as may be properly submitted before the committee.
I don't know of any. Next item.
G, public comments.
Is there anyone online?
There's no one on Zoom indicating that they would like to speak.
Okay. All right. Is anyone in the audience? Anyone in the audience would like to speak? All right. Now, thank you so much. The next item,
Adjournment.
it's been moved and supported. We are now adjourned. Thank you.